Coming up today, she struggled to walk, couldn't stand up straight until she got a new pair of knees. See the high-tech surgery that transformed this woman's life. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. When knee pain gets bad enough, you stand less and you sit more. But for Joyce Zerger, it wasn't just pain. Her knees gradually deformed, turning inwards until she could barely stand without a walker. Janine Kiesling shows us the surgery that gave Joyce a second chance at walking upright.
At 92 years old, Joyce Zerger is defying expectations, walking without pain after years of struggling to stay on her feet. Not long ago, Joyce's knees were turning inward. The pain forced her off the golf course and onto a walker.
That was very depressing for me because I had been so used to being so active, did a lot of volunteer work as well as golfing.
Her balance was fading fast. Her family moved her into their home, but even that didn't feel like a long-term solution.
We were concerned about Joyce and her mobility. If she got to the point that she was unable to walk or transfer herself in and out of bed, we were going to have to place her in the nursing home, and that's something that we didn't want to do.
Then what seemed like a setback, a serious foot infection, turned out to be a blessing. Joyce was referred to Dr. J at the University of Kansas Health System.
I guess fate that the hospital referred us to Dr. J for the wound healing, and he said, well, as soon as the wound is healed and your foot is good, then we'll assess your knees.
That assessment revealed something surprising. Joyce was a great candidate for robotic double knee replacement.
That was very scary to me to think I wouldn't make it even at my age. But Dr. J was so reassuring. He just made you feel like this was going to be okay.
2 surgeries later, the transformation was remarkable.
Oh, it was amazing because we had gone to a particular winery that we both really enjoy, and they were amazed at her transformation.
It was so amazing that I could stand up and walk like I used to.
For Joyce Zerger, 92 is just a number, and walking pain-free is her new normal. Her message to others, never give up.
I am very thankful that I had Dr. J, and we have recommended him to our family members and our friends.
And we are so happy to have Joyce Zerger and her daughter-in-law, Shelley, joining us here today. Ladies, good to have you.
Thank you.
Good to have you. We're also so glad to have Joyce's surgeon, Dr. Anil Jiwanlal, with the University of Kansas Health System. You go by Dr. J.
That's what they call me.
That's what they call you. All right. Well, we're going to call you that here this morning. So good to have you as well. We're also going to be taking a much bigger look at the robotic surgery program here at the health system. And joining us with that perspective is urologic oncologist Dr. Mobin Mirza. He is specialized in robotic surgery. Doctor, so good to see you today.
Thank you.
We're also joined virtually this morning by Erin Rappel, clinical nurse coordinator for the robotic surgery program. So we'll speak with her here in just a few moments. But Joyce, let's begin with you. This is what we're talking about, your life and how it has changed so much. Are most days pain-free for you now?
Pretty much so. Sometimes stairs will be a little bit painful, but most of the time, I don't even think about it. I just walk and do what I want to do anymore. It's been wonderful.
Well, we like to hear that. Shelley, how has this surgery, as you've seen it from your eyes, changed Joyce's life?
It's given her a quality of life back. We're able to go and do things that before we weren't able to do.
So, Dr. J, let's go back to when you originally met Joyce. Talking about surgery, it can be a daunting conversation with patients, as we know. What did you tell her about the expectations from this surgery?
Yeah, so with any procedure, you have to talk about risks, benefits of surgery, and also the post-operative recovery. I think in Joyce's case, as you can see from the videos, that was an easy conversation because her quality of life was terrible. And so we really didn't have to talk too much about surgery because we knew that that was really her only option.
Well, we've joined you in a similar surgery. Just describe it for us, if you would.
Yeah, so I do my knee replacements robotically. So as you can see in that video there, we're using the robot to create a three-dimensional image of the knee. We then plan the surgical procedure, and the robot essentially helps you execute that plan. So I've mapped the knee there, you can see, and then we're doing the tibia, which is the bottom part, the shin bone, so to speak, of the knee. And here now we're resecting this bone from what we had planned. And so the robot helps you to execute that plan. And so if you go outside of the plan, it won't let you take bone away.
So what is the recovery like?
So for knee replacement is not an overnight procedure. You don't wake up and it's all over. So Joyce knows probably better than anybody that it's a recovery, and it can take several months before you return back to normal.
So how common is a great outcome like we've seen here with Joyce?
Well over 90% of patients do well and are satisfied with their outcome. But like I mentioned, every procedure has risks, so you have to be thoughtful of that before you make a decision about surgery.
Well, Joyce, I have to ask you, how was your recovery? What was that process like for you?
You know, the first one was a little difficult, and I had to use the walker quite a while, but even in the hospital, I could tell the pain was less. And it was just one of those things. I was made up my mind I was going to do this, and it was great.
You went into it just knowing that you were going to handle it like a champ.
Yes.
You're ready.
And nothing could have been worse, so this had to be better, and it really was. It's amazing.
Well,
Yes.
watching the video of you is amazing, quite frankly.
Yeah.
It's very cool to watch.
Uh-huh.
Well, surgeries these days, as we know, as we've seen, could be very high tech, and they can look very different too, depending on the technology. The health system's robotic assisted surgery program started 20 years ago and has grown from just 2 surgeons to 37 and counting. Today, we use robotics in several specialties, but Dr. Mirza's specialty, urology, was the trailblazer. Dr. Mirza, when we say robotic surgery, what kind of robots are we talking about?
So specifically for what we do in urology and surgical subspecialties, we're talking about multi-port and single-port robots manufactured mainly by one company right now, which is called Intuitive, and these are called Da Vinci systems. So what you're looking at typically is a system which the surgeon controls away from the patient's body, and the patient's body houses all the instruments that are being used to do the surgery. Obviously, these have now expanded into orthopedic, neurosurgery, even pulmonary sort of realms, where robotic surgery is assisting us to do a better job for our patients, and really bring patient quality of life outcomes, as you've seen here today, as well as precision outcomes to a different level for us all together.
So let's say somebody needs their prostate removed. You could do it the traditional way. Why has robotic assisted surgery become really the new normal?
Yeah, I think the new normal for prostate surgery happened several years ago. So I think open prostate surgery is a thing of the past. We do it sometimes in specific situations, but the outcomes in terms of when you're actually doing the surgery, your ability to see things better, access an anatomy that you weren't able to access before, being precise about things like nerve sparing, really changed the way things are happening in the operating room and then afterwards. Blood loss is a lot less. Patient recovery in terms of pain afterwards is amazingly improved when you do robotic surgery. So robotic prostatectomy is where things sort of started for the specialty of surgery in general. And that was sort of one of the first procedures that we pioneered. And now, we've expanded to many different specialties. You said 37. As of this morning, it's 40 surgeons who do robotic surgery on these systems in the hospital. We do about 2,000 cases a year of these type of surgeries, and over the program length now, close to 20,000 surgeries. So it's pretty immense on how much work we can get done and how amazing our teams have become at doing this. And it's just not urology, it's ENT, it's cardiothoracic surgery, gyn-onc, general surgery, urology, surgical oncology. And then we've added orthopedics into this, neurosurgery, pulmonology. So it's an amazing amount of work that's helping our patients.
Literally growing by the day.
Yes.
We recently joined you in a procedure. Just tell us a little bit about what we're seeing here.
I think this is us doing a robotic prostatectomy. I'd actually don't remember that well, but yeah, it is. I can see now. So this is a patient who has a high-risk prostate cancer, and we're using the machine. So the robot is not doing anything automatically. There's no automated task. Many patients think that I'm going to set it and go drink coffee outside, but you can see that the machine is docked, and then I'm sitting on the console. You saw my fingers a second ago doing the surgery, and look at the detail that we see. Typically, if I was doing this open in the old models, you'd be looking at the anatomy like 2 or 3 feet away from you. Now I'm looking at it, 1.5, 2 centimeters away with a 12 by magnification lens. So the amount of detail we can get and the work that we can do with that detail is pretty impressive. And to be able to do that on patients who are obese, who have high-risk disease, is a really a sort of barrier-breaking work that we can do now, which we weren't able to do before.
And you touched on it a bit ago, but how different is recovery for patients when it's robotic versus, back in the day, if you would, with those traditional methods?
Yeah, I mean, these patients, when I was a resident, for example, and we did open prostatectomies, would go home, 3-4 days later, sometimes quicker, depending on the patient. We can do these surgeries now same day. Most of our patients like to stay in the hospital overnight just to make sure that they're doing okay. So most of these patients go home the next day, and they very rarely have any complaints about pain. We very rarely use narcotic pain medications for them anymore. So the recovery is pretty quick.
Aaron, good morning. We're glad you're with us this morning. Just again, provide us some perspective of just how big the program is here. Dr. Mirza talked about how it's growing, but just give us some more details.
Yeah, so we are one of the biggest robotic programs in the city. We have 5 XIs and 1 SP. 4 of those XIs are on the main campus. As Dr. Mirza said, we, since starting our program in 2005, we're getting close to 20,000 procedures performed at the health system. And we do robotic procedures in all of our ORs, so the Bell OR, Cambridge OR, CVOR, and our satellite surgery center at Indian Creek.
And Dr. Mirza mentioned urology, gynecology, cardiac, thoracic, surgical oncology, ENT, the list goes on, general surgery. Again, how many patients are we treating with robotic surgery every month, every year? Put that into perspective for us again.
So last year we performed 2,036 procedures, so quite a bit.
Quite a bit. Oh, this is a fun part. You've had some good times with naming these robots. Tell us about the names.
Yeah, so currently the robots on the main campus are named after the Transformer robots. So we have Optimus Prime, Bumblebee, Prowler, Jazz, and Megatron. So the way we come up with these names is the OR staff members did a vote, and we eventually landed on these. We actually have a vote coming up here soon because we're getting a new robot and then replacing our old fleet here soon. So it'll be exciting to see what everyone chooses this time around.
Okay, the big reveal, the big name reveal. I like that. Okay, so one of the newer robots that we use is a single port, multiple tools with one single arm instead of multiple arms. What kind of surgeries only need one arm?
Well, currently we use this robot in ENT and in urology. For the ENT procedures, we perform radical tonsillectomies, and then for urology, we do procedures on kidney and bladder.
Erin, let's talk about what you do. What does it mean to be a clinical nurse coordinator?
So I am the advanced MIMS clinical nurse coordinator, so the robot coordinator. I resource all of the intuitive robots, so the Da Vinci Xi, SP, and then the Ion. Really, my main role is to help drive the program's goals and initiatives and resource staff members and the surgeons.
I think we changed your title to robot coordinator. I think that's what we're doing. That's a very cool title. All right, so if you have questions right now and you're watching, be sure to ask those. You can use the chat on YouTube or Facebook. You can email the Medical News Network. That information is right there on your screen. Joyce, as we saw in that piece that we ran at the top of the program, you live a very active life. Tell us about what you're able to do now, or what you're back to doing, I should say.
Okay, I can do some housework. I can help Shelley with some of the housework. I can also get into their endless pool and sit in a pool chair as long as I like, and also I do a lot of reading too, but I can just go out and sit on the patio or whatever I want to do anymore.
And you and Shelley get out and about.
Pardon?
You and Shelley like to get out and about, I
Yeah,
hear?
we do. We go shopping and things like that, and I can do that anymore. I'm not quite as fast as she
That's
is.
okay. None of us are. None of us are. I think that's okay. But getting out there, it just must be so nice to have her back.
It is. It is definitely. As before, she was very sedentary, wasn't able to do a whole lot of anything except her basic needs. And now we're able to go shopping, to go to wineries, she can go up and down the stairs. She was pretty much secluded in the lower area of our home because she couldn't navigate the stairs prior. So it's been nice.
Back to wineries.
Yes.
That's good. That's good. Got her back to the wineries, Dr. J. So Joyce, so we provide good parking for our guests when they come onto our program, but as we know, hospitals require quite a bit of walking and navigating. How hard would it have been to get to our studio had this operation not have happened? How difficult would this trek would have been for you?
Well, I know what would have happened. They would have stopped at the door and had me get out and say, go wait inside until they would walk to where I was. So I just really couldn't navigate any place too far at all. I couldn't have walked very far at all.
It would take some planning.
Oh, sure.
A lot of planning. Shelley, this is probably, it's kind of like a balancing act, trying to keep Joyce active while also making sure she's not getting injured and taking any setbacks. How are you balancing that? Also keeping her active and letting her live her life, but also making sure she's staying safe?
Well, she's very careful, and I'm constantly telling her, be careful, I don't want her to fall, because that would give another setback. But without this surgery, frankly, she would have been in a wheelchair and she would have been in the nursing home. So this just allows her to live her life of whatever she wishes to do on a daily basis, and she's really not restricted by anything, maybe distance, but she is 92, so she does great and wonderful for where she's at.
She does great. She looks great.
Yes,
We're
she
so
does.
glad she's here. So Dr. J, knee pain, so common for older adults, but who's a candidate for this type of surgery?
So really the main indications for a knee replacement procedure is severity of disease. So typically we want to see patients have moderate to severe disease in their knee. And then also they have failed non-operative treatment. So they've tried all the things like injections, physical therapy, anti-inflammatories. And if those don't work, surgery is an option.
Dr. Mirza, robotics requires specialized training and equipment. We know it's expensive. What are the benefits, though, for the patient?
Yeah, the biggest benefits for the patient, I'll say a little bit about our program. One is you're getting experts in the field. Whatever they're getting their surgery for, you're dealing with not only a surgical expert, but a content expert, a thought leader, a research leader in that field. You're getting a team of people who are just so savvy at this. They've had so much repetition at this, so much training at this. And at the end of the day, the benefit for the patient is what we've already demonstrated here today. It's quality of life. That's what we want for our patients. And there's some balance, when we're doing cancer treatments, that there's going to be the treatment of the cancer and then whatever the side effects of those treatments are. So to minimize that and the recovery process, accelerating that, those are the key things for the patients.
What benefits have you found as a surgeon using robotics versus old school methods? Yeah,
I won't have to see Dr. J for a back surgery probably anytime soon.
Right.
The biggest benefit is, your ability to, especially for urologists, when we're working deep in the pelvis, you're twisting in ways and your ergonomics get really screwed up. So with robotic surgery, you get to sit on a console and do everything sitting down in a relaxed position. The stress level can be higher sometimes. It's easier on your eyes. Growing up, we all like toys, we all like technology, so to be able to apply those to real patient outcomes and to be able to help your patients, that's really rewarding. So I think it's immense for us, and we're a high-level training center here for our residents, our fellows, so all of our residents and our fellows graduate very savvy at doing these procedures. So this is the new, like we don't have to do extra training to figure these things out anymore.
Well, let's get to some questions from our viewers. And on the note of what you were just talking about, Jeremy had a question. What does it take to get trained on these robots? Is there any interval training where you have to recheck back in and get training as as technology continues to evolve.
Yeah, absolutely. So the first answer is, if you go through surgical training, you go through a residency program. Both Dr. J and I have done a 5-year residency program in our respective specialties. And then you can further your training by doing fellowships and, joint fellowships or cancer fellowships. And those fellowships allow you to sort of become content experts as well as a surgical expert. So that's the training that's required to become an expert in the field, whether that's robotic surgery or any other surgery. And then for check back, we have quality assessments for our own work. As new technology comes out, you go train on it. Once you've done a couple of things, you sort of become savvy at it, so you don't need a complete retraining, but sort of an introduction to the system, what it does, safety measures, so on, and then you can start working on it.
Ruth Ellen has a question. What concerns and challenges are there when you're performing surgery on someone as they get over the age of 90?
Well, you obviously have to take everything about the patient into consideration, and age is always one of those things. But I often say age is just a number. I mean, and you can be 90 years old, and if you're active and healthy, I think you're a perfectly fine candidate to undergo a surgical procedure, again, as long as you understand the risks and the benefits and you understand the recovery.
Stuart wants to know how many different tools or instruments are at the end of those robotic arms?
Oh boy, Aaron might know better. I use 3, so. But I think there are probably like 10.
Aaron, we saw the little tentacles going on there. What are those all about?
So wait, you're asking how many different robotic instruments that they have available for that system?
Well, yeah, that come out of each arm. There's each arm, and then we saw like the different type of tools that come out of each arm.
Oh yeah, so there's 4 arms on a multi-port system. One of the arms holds the camera, and then 3 of them hold the actual surgical instruments.
And then how many instruments could come out of each of those arms? Little tools
I think there's one instrument
per arm.
Oh, out of each port.
You can exchange 2 different instruments. So I can have a scissor, a different type of grasper, some sort of energy technology there. So, for the surgery I do, for example, that you were seeing, I'm using 3 instruments. I'm using a pair of scissors, a grasper, and a broader grasper, which has some energy associated with it as well. But there's a whole menu of instruments you can put in. I think that's what was being asked.
Yeah.
And that's about 10 to 12 instruments that can be exchanged in and out of those arms.
Okay, Stuart also wants to know, is there a backup plan just in case the technology malfunctions?
Yeah, you're the surgeon, you're the backup plan.
And
yeah.
you are the backup. Yeah. That's a good backup plan.
Yeah, I think you need to be savvy and trained in both ways, and to be able to convert a surgery from a robotic to an open surgery using your own sort of skill set that you have. So we don't do that much anymore. We used to track like whole conversions and things like that. Over the years, our teams have just gotten so good at it that it's just sort of a very rare event. Yeah.
Jill wants to know, do the robots or the surgeons make the initial incision?
We make all the incisions, yeah. So what we do is we make incisions, we put the ports in, which are sort of these conduits, and then we attach the robotic machine to it. And once we've sort of targeted our area of work, then we put the instruments in, you hit the activate button, and then you can control everything from the side.
And Alexis wants to know if robotic surgeries are generally covered by insurance.
Absolutely, yeah. This is now the standard of care for many things that we do and most things that we do in urology. So yeah, insurance is covered just as much as they would any other surgery.
Dr. Berza, what do you want the big takeaway from our conversation to be today?
Oh, I think big takeaway, Dr. J has already said it best. Take care of your patients. Don't treat them as a number. Focus on their quality of life. Focus on the treatments that we can give them. And I think the second big takeaway is we've got an immense level of expertise with our surgical programs in general and our robotics program, and specifically with a whole set of surgeons, teams, experts that can really help our patients. So we really want to amplify that and let our patients know, our teams know that we're here to help everybody.
Aaron, what's the big takeaway today?
I think Dr. Mirza said it perfectly. We're here to take care of the patients and give them the best option for surgery, and honestly, robotic surgery is the future.
Shelley and Joyce, we're so glad you both came in today to share your experience and your story. Shelley, what's the big takeaway from folks who are listening and watching today?
It's never too late to get your quality of life back, especially when there's specialists and angels in the field that can do this for you and that are willing to do this for you. That, we took a leap of faith, and this is where we're at today.
Joyce?
Well, first of all, I want to thank our dear Lord above, because I did say a lot of prayers. And second of all, I want to thank my family for taking me in and allowing me to have a life like I have today. And then, of course, Dr. J. We can't thank him enough. It's just been wonderful, and he was so kind and helped us understand what we were going to go through, and it was so, I'm just happy to have my life back, and I thank Dr. J and my family and all.
Oh, well, I think they're so glad to have you back.
Thank you.
Yeah.
It's wonderful.
Is there anything you're looking forward to doing? Is there anything
Well, I know I can't golf anymore.
How many days a week did you used to golf, by the way?
Pardon?
Were you a big golfer? Like, did you used to golf a lot? Yes.
Oh, I just belonged to a women's league, and we just would always, once a week.
Good. Was she pretty good?
It depends on who you ask.
I love it. I love it.
Yes, but other than that, being able to get into their pool and just to go shopping and to go to the wine rear, I just act like I could do it all.
I like it. I like that. I act like I can do it all. Then go do it all. That's fantastic. Dr. J, it just must be a total treat to be sitting here with her today.
Yeah, it's always, it's painful probably to see the earlier videos,
Yeah.
but the after is just always such a treat. It's why you do this.
I
And
bet.
so it's always fun to see Miss Joyce here. So.
What else do you want folks to know? What's the big takeaway for those who are
I
watching?
kind of echo what everyone else has said. We use these technologies to improve patients' lives, and when you can see an outcome like Joyce's, it really brings to light why we do this, and we're just always looking for tools to make us do a better job.
Well, thank you to all of our guests today. This is a great program. We appreciate it. All right, get out there. Get back to it. All right? All right. Thanks to all of our guests and to all of our viewers for being with us here today. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update.
But the heart can reflect memories. Sometimes you just don't want to see.
Music, medicine, and a whole lot of heart. I'm Jessica Lovell on the next Morning Medical Update. The story behind this jam session inside an infusion clinic. Meet the patients turned performers and the nurses who see the healing power of music. Monday at 8.
Join us tonight at Kauffman Stadium for our next Royals Health Awareness Night. Tonight, we highlight brain health and the experts advancing science in everything from Alzheimer's to epilepsy to migraine and more. Stop by Gate A before the game to grab some free Royals swag, visit our photo booth, and enter for a chance to win a Royals gift card. See you at the K.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.